Good morning. Today is Wednesday, June 9, 2021, and we'd like to welcome everyone to the board meeting. We'll call this meeting to order at 10 a.m. You can join today's board meeting via phone, dial 971-254-3149, conference ID 736-023-979. Audio capabilities are listen only and are offered on a best effort for the public. Our meeting is also live streamed, and you can join us by going online to tctvonline.com and click on live broadcasts. Before we get started, I'd like to remind everyone to mute your phones. You can do this by pressing *6. Please unmute yourself when your agenda item is ready to be discussed. All others must remain muted. Thank you. Public comment. The board will allow public comment at workshop and board meetings during a public comment period. Those intending to provide public comment for the workshop or board meeting shall email submissions to publiccomments@co.tillamook.or.us. Public comments received by 5 p.m. on Tuesday will be distributed to the board and become part of the meeting public record. You may also mail your public comments to the Board of Commissioners office at 201 Laurel Avenue, Tillamook, Oregon, 97141. Public comments submitted by email after the deadline or during the workshop or board meeting will be presented by staff to the board during the public comment period. Unless otherwise specified, these submissions will be presented during the board meeting. Okay, well, I'd like to welcome everyone who's here, ask our guests to sign the guest list, and we will open the meeting with the Pledge of Allegiance. Commissioner Scar, will you lead us?
Absolutely. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, I'll ask Isabel now if we have any public comment. We do not. So we don't have any non-agenda items today, and I can say that item 11 on the agenda has been postponed. So moving on to item 5, we have the COVID-19 vaccine update with Marlene Putman, Director of Health and Human Services.
Good morning again, Commissioners. So happy to provide another update, and I'll try to include a few items we discussed a little bit earlier this morning. So Tillamook County will remain at the lower risk category for the next movement period, and that is through June 19th, I believe, or June 17th, with review of data for a 2-week period through June 19th. So we have had 9 new confirmed positive cases of COVID-19 between the 23rd of May and the 5th of June, kind of in this cycle of reviewing those in that time frame. The previous period, as folks may recall, was 10 new cases. So we're staying low in those positive cases. That's really good to know. We want to stay there. Unfortunately, we have had 4 deaths in Tillamook County, and right now 672 positive cases. Just reminding people, it's still out there. COVID-19 is still circulating in our community, in our state, in the US and the world. So if you're feeling ill, experience some of those COVID-19 symptoms, call your healthcare provider, give us a call. We can talk about whether you need to be tested. We can get you in real quick, same day, get that testing done. Also, reminder on the interim guidance for people that are wondering why there's differences between different locations that they might visit, businesses, institutions, those kinds of things. The interim guidance from the Oregon Health Authority does give businesses and organizations a choice. So if they have a policy in place to verify vaccination history, then they can relax the mask mandates for fully vaccinated people. Otherwise, they can opt to keep mask mandates for all in place. So that might be businesses that are like, we don't want to have to go through the steps of asking people to show proof. That information around the guidance is available at the Governor's Office website as well as the Oregon Health Authority website. We discussed briefly this morning also about variants. We've heard about them in the news in different forms, and there are variants that are circulating in Oregon. our region for the variants, so it doesn't break it out by Tillamook County, but our region includes Clatsop, Clackamas, Columbia, Multnomah, Tillamook, and Washington counties. So a pretty big area. And just a quick look at the list, we have 5 variants of concern that the state is monitoring. The most that we've seen in one count is 224. There are other variants of interest that have 11 or less current cases, and there are about 8 of those variants. So Oregon's keeping an eye and on top of disease surveillance at this point with the process that they're currently using. I don't have a lot of detail on how the process works, but I can provide more at a later date if you're interested. So vaccine, I think we all know now that the state goal is 70% of Oregonians to have received at least 1 dose of the COVID-19 vaccine in order for those restrictions to be lifted. As of yesterday at 6 p.m., it was announced through OHA that the state is at 67.1%, or 2.9% left to reach, which is approximately 97,000 people. For Tillamook, and this data for us is as of Monday, we were at 62.8% of our 65% county target to be able to remove those restrictions. So we need 2.2% to reach that target and then be able to lift restrictions. This is about 480 people. And again, we've been doing and providing vaccines since Monday, so we are likely closer to 63% of our target at this point also. Vaccine resources are changing up a little bit in June. Not as many big events being held as we get to smaller numbers of people. So for the month of June, for the health center and public health, we are having appointments at our 8th Street Annex, which is right next door to our clinic in Tillamook between 8th and 9th Street, right off of 101. So on Tuesdays and Thursdays, people can come in and receive different vaccine types. So if you're interested in Pfizer, you can come in on Tuesdays, and Moderna is on Thursdays. Both days will also offer Johnson & Johnson. So just a reminder, Pfizer's authorized for those 12 years of age and older. So if you want to come in and receive those, we can do that on Tuesday. You can call us, or you can come on in, call our 842-3914 to schedule. And for those who are still staying on top of their boosters and concerned about where they're going to get their booster, if you received it at a specific location, your booster will be at that same location for Tillamook County Fairgrounds. If you got your vaccine there, you'll get your second dose or booster there as well. If you can't make it on our Tuesday or Thursday vaccine events, you can also participate in several other venues. So one is June 9th. The Creamery is hosting today between 10 a.m. and 6, so it just started, a drive-through vaccine with free ice cream. So you can have your ice cream sandwich while you're waiting your 15-minute observation period and receive some coupons for 3 scoops of ice cream. And on June 19th, the Health Center and Public Health will do like a summer kickoff for a vaccine event from 10 to 4 on Saturday, offering all forms of vaccine that we have, Pfizer, Moderna, and Johnson & Johnson, for people that haven't been able to access some of these other sites. And last but not least is you can receive your vaccine through your healthcare provider, and still pharmacies are available. So local pharmacies, Fred Meyer, Safeway, Tillamook Pharmacy are still available for people to schedule appointments. Talk to a trusted healthcare provider for you or your pharmacist if you've got questions, and they'll be happy to answer those for you. We're asking that people choose to get their vaccine if they've been hesitant before June 27th, so we can help the state reach that 70% goal of first dose vaccination, but also our Tillamook County rate of 65%. And remember, there's those other drawings, whether you support them or not, $1 million, or incentives by county too for $10,000, and then those education incentives too. So once we meet that 70% vaccination rate or goal for the state, then the risk level framework is changed and all county-based metrics and health and safety restrictions are lifted. We're looking into that for our county. County commissioners asked we look more into that for our county so we're prepared when that happens. What those restrictions cover include things like masks, physical distancing, capacity limit requirements in almost all settings. Of course, there's some exceptions for those consistent with federal guidance, including airports, public transit, healthcare settings, and the like. And this includes the lifting of the vaccine verification. So that won't be necessary in these locations. So as indicated, your public health staff and the commissioners are looking into this new guidance, and that includes quarantine, travel, and other restrictions. If you have, like our community has questions, or you individually have questions, you can always, as I said, call us at our 842-3914-85, English and Spanish, and we'll answer your call or return your call. You can also go to our website at tillamookchc.org for more information. So that is my update for today, but happy to answer any questions.
Thank you, Marlene. Do we have any questions or comments for Marlene at this
Just
time?
that we had a super robust conversation about this at 8:30, and just really kind of saying to the community as well, as we kind of did talking about staff, it will take a little time for businesses to unroll the guidance once the governor makes her announcement. When the CDC guidance changed, there was this lag period and lots of confusion about, well, the CDC says this, what does that mean for Oregon? Should we be able to just follow that guidance? And recognizing that the guidance is still driven by OHA and OSHA for workplaces. So even if the governor comes out and says, today was our 70% mark, recognizing that businesses that you frequent will have to wait for OHA's guidance and the OSHA guidance in order to know exactly what applies to them and exactly what they have to do to stay in compliance. So I think just asking the community to have patience. We're all super excited that we're getting closer to 70% in Oregon. Please be a part of that. Please get your vaccine if you are able. And recognize that when the governor makes that announcement, there'll be a little time for local businesses to determine what needs to happen and to be patient with them at that point.
Thank you.
I would concur with everything Commissioner Starr mentioned.
All right, thank you. Thank you, Marlene. We're grateful for your
Thank you.
leadership.
And the same goes for me with you. Have a good day.
You too,
Thanks,
Thank
Marlene.
you.
All right, moving on to item 6, we have Dr. Don Olson presenting to us on transcranial magnetic stimulation program for veterans. Dr. Olson, we'd like to invite you to come up to the front, and we'll invite Nick Torres to come up with you.
Dr. Olson, I will mention to you, that microphone is kind of there for looks. There's a microphone right over your head which picks up everything in the room. So just want you to know.
Can I take this down to talk?
When you're speaking, I think that would be fine.
It's easier to. Well, thank you very much for letting me be here. So, I'm Don Olson. Many of you know me. I've been over here at Adventist as a doctor for the last 6 years, but I'm not there anymore. I'm working on this project that we're here to talk about, transcutaneous electromagnetic stimulation, otherwise known as TMS. There are types of TMS that are different than others. The type that we have is deep TMS, and it's a takeoff of what we use in neurosurgery to do brain mapping, which we do in the operating room when we do brain surgeries to not destroy eloquent areas. So specifically this device that we now have here in Tillamook, we're working with the veterans with the idea of developing and producing a program that can save lives. We've got a terrible problem in Tillamook County with suicide. And I'm a veteran. I'm a retired Army 06 full colonel, and I've had the pleasure of being a neurosurgeon and the pleasure of being a doctor still, and boarded in both in pain medicine and in neurosurgery, and having been a clinical professor at OHSU and continue to feel very strongly about our vets. I want to tell you a story that's real that happened that motivated me a lot, and that is a fellow named Jake. Jake was a veteran of the first Iraqi war, as was I, and he had the misfortune of being a sniper. And we asked terrible things of people when we were in the army, and most of us live through it, but you never forget it. And well, Jake was on the edge, and he was back in Omaha, Nebraska, and he got involved in a situation at a Black Lives Matter march that he went to. He shouldn't have, but he did, and someone was killed, and he was accused. He was exonerated, and then called his best friend who lived in Oregon, and he being in the living out in DePaul, being in the family that owned the bottling company, and if you don't know it, I own a winery called Torrey-Moore Winery, and so I know all about bottling companies. So they called me and said, "Would you hire Jake?" And I had a position open. I said, "Sure, I'll hire Jake. Have him come on." He moved out from Omaha, Nebraska, moved to Hillsboro, brought his family, and proceeded to get going with my company. And what happened was later an aggressive prosecutor in Nebraska decided to retry Jake for something called felony terrorism, which had never been done before, and the end result being Jake couldn't handle it. And so on a Sunday morning, about 10 o'clock in the morning, I had a phone call, and it was Jake telling me that he was losing it and giving me what to do. And that being said, I addressed him to the VA clinic in Hillsboro. He went looking for it. He found a neurology clinic and found the door locked, and then proceeded to put a gun in his mouth and kill himself. And a terrible loss, in my opinion, and something that I think we as soldiers, we as human beings have to be responsible for. And so that's why I'm doing what I'm doing. That's why I'm not at the clinic anymore. This is why we're doing this TMS program. But again, the TMS program by itself is a good program, but we've gone a little bit further. I've hooked up with a company called Virtue, which is a recovery center up in Astoria. They have one unit in Astoria with detox and the whole facility, and they have 3 facilities in Arizona, and they're expanding all over the place. They've asked me to help them with this program, and I've asked to be able to include telemark. And that being said, we're at the stage where we need support, and we need support from you guys to know that we need to work as a team. Teams work. We need to work together to work for the betterment of people in not only Tillamook County but also Clatsop County. And to do that, we need to have a program and a home, so to speak. I put an office over here in the 2nd Street office building next to the restaurant, and yesterday I got a commitment from the owner of the building that this is new news, that he will vacate the entire building, and with the exception of the restaurant, and turn this to a crisis center if we can raise the money. And I'd like to do that. And I think we could put that to a hospital grade level. There's a beautiful upstairs level that's be perfect. He would vacate everything on the, including the basement, would be vacated to use for a special program that I've been chatting with Arlene Soto with over at the community college. A program to fit into my other life, my farmer life, and that is to say, growing wine grapes. And right now, wine grapes are it's a big project in Oregon. Wine's a big deal in Oregon. So But the problem with that is it's subject to all sorts of outside interferences, like last year's smoke. And it puts a huge impact on the industry. One of the things that we've learned in COVID is that technology does work. We can do things with telemedicine, like virtual, like we just saw, that we couldn't think of before. But we're doing them, and we're doing them every day. And the beauty of, I mentioned the Arizona project with the virtual people. They passed a law, and just recently, the governor signed in Arizona that those of us like licensed here in Oregon could follow patients in Arizona through telemedicine, and that's going to be huge. And it's what we really need to reduce the cost of medicine. And the other thing that we can do, which we've learned with technology, and because I hang out at the Blimp sometimes and talk to people out there, and I rent space out there from them, and there is a possibility of doing indoor farming. And indoor farming in the grape business is all computer controlled and something brand new. It's being used in other industries in limited capacity, but never in the wine grape business, to my knowledge. Well, the community college is excited about this possibility, and they say there's grant money available. They say that they have a program that they could offer some facsimile of a degree in that program, and we could have the facilities to start with as a pilot program, literally in the basement of the building over here on 2nd Street. And so, bottom line is we're starting a big project, but a project like this can't start without one first step, and this is the big first step to get you guys to support, and then to move forward politically and try to muster support and get the government into doing what we're doing to make jobs and to be able to give people, our vets, an opportunity to have a life and be able to maybe eventually have a VA clinic right here in Tillamook. And I was up at the camp of Camp Ria up at Astoria, yeah. They have a little VA clinic there, and because I'm an Army colonel, they let me in, and I get to have pick of the choice up there, and but it's a nice arrangement, and I know Susan, and she, being now covering both counties, is excited about us trying to do something, and so that's why I'm here, and I will answer any questions you want me to answer, and I hope that we can come away with a program that we can bring back to you as something on paper, something that could be put together as a community-driven program. I've talked to Eric at Adventist, he's in favor of it. Frank Williams and the people there are in favor of it. And the equipment that we have right now, ready to go, is state of the art and is brand new and ready. And so we just have to get a structure. And like every business, this one has to operate like a business. The structure is everything when you do a business. I learned that in the wine world. So it is what it is. So thank you for letting me talk. So.
Thank you. Questions for Dr. Olson?
Dr. Olson, you have dropped a lot on our plate today. First of all, I'd like to address Nick. Nick, is this something that you are endorsing? Is this why you asked Dr. Olson to be here this morning?
Yes, this is something that Veteran Services is endorsing. My predecessor, Bill Hatton, he started helping Dr. Olson navigate some of the hurdles presented by Tri-West. So we're in absolute endorsement of Dr. Olson's services.
Thank you. So, I mean, a crisis center in the 2nd Street building, that's a very interesting concept. If this were to become reality, would you treat not only veterans, but other individuals in mental health crises?
Definitely, that's the whole purpose, is to get this as a mental health center, basically speaking. And a true crisis center where you can get people who at the edge and get them into programs and that would bring them back to functional reality, so.
So you have some support, which I am grateful for. Frank Hanna Williams at Potomac Family Counseling and Eric Swanson at Adventist Health. The SBDC, I'm not sure, so Small Business Development Center.
We have to, the SBA, you mean?
You mentioned Arlene Soto
Yes, that's the SBA, and community college,
at the community college, although she is retired now.
here in
And they're looking for someone. Have you reached out to Terry Cooper at EDC, Economic Development Council?
aren't they the same?
No, SBDC and EDC would be different.
Well, she directed me to Laura, what's her name, for the state, and I went to her, and then she directed me to two other people, and so, but it all comes back through Arlene Soto here in Tillman.
So one other issue, the indoor farming issue. I mean, I understand that. How does this roll into a crisis center?
Well, it's interesting, because it could. People, when they come out of crisis, well, let me tell you a story, another story. When I was down in Arizona, a couple of weeks ago, and these people, there were about 10 or 15 of them that just had come out of detox. And I walked in, and it was kind of an unsettled situation, and a huge person came up to me and said, some doctor put me on too much medicine. He put me on gabapentin, and I went crazy, and I just want to murder everybody. And he says, I still feel that way. What am I going to do? And a little unnerving, quite frankly. And so I said, let's first sit down and talk. And so I first talked through the idea of what the medicine is and what should and should not be taken, and apologized for some colleague that I've never known who gave him the wrong dose of medicine, and said, we got to start by first getting you off this stuff, and like opioids and things of this sort, we got to get rid of that stuff. And then we got to get you on a program that makes sense. That's where TMS comes in, that's where it is effective, because it's virtually without risk, it's totally non-invasive, and it doesn't require any drugs at all. And it can assist with things like medicine-assisted treatment programs, and because of that, I brought in as an employee a young man who's unfortunately not here this morning, but he's certified in drug and alcohol treatment, and he is he's a native of Netarts, but he's just moved up from California, where he was for a period before coming here, and working there with his MAT part of the state of California's program out of Sacramento. So it's a real asset to the guy. So that's going to work really well. So how does that work with farming? We got to have something for these people to do. And if we can give them something to do that will be a brand new program as far as an industry is concerned, something that hasn't been done before, it's something we've got sitting in our laps here in this county, why not do it? And because it could facilitate the community college and doing an educational program, so it's not only jobs, it's not only education, it's treatment. It is important to have work, and I know for myself, sitting around I go nuts, and I have to be busy. And, so retirement for me is not something I want to do, and I've been asked many times, but I'm not going to be that person. So I don't know if that's a good answer to your question, but
It does answer it to some extent. One further question. So the Veterans Administration is in full support of this treatment regimen?
yes.
So, I'm sorry, one more question.
As is the Food and Drug Commission, as is Medicare, as is Medicaid, all of fully approved.
So you mentioned in the letter, Nick mentions Tri-West. Is that Tri-Care? I'm familiar with.
No, I'm
Tri-Care for
TRICARE
Life.
too. TRICARE for
Okay.
Life is what I have.
Okay.
And the Veterans Healthcare Program has by many people been criticized. And they, not only have they been criticized on a local level, state level, but on a national level. So they formed something new. It's called Tri-West. And Tri-West covers the entire western United States. And it is what we now have to do. And Virtue is already certified by Tri-West, as they are by Humana and all the other private insurance companies, and the VA. And so the VA is transferring all health care to Tri-West for their insurance. And we are getting our stamp as well. I was a previous provider for VA activities here at Adventist, and you have to go the paperwork, you know what I mean, so.
So what is your ask of the Board of Commissioners?
What is what?
What is your ask? What are you asking us for today?
Your support.
Just, so a letter of support, you just want this board to start advocating for what you're doing?
I would like to know that one, that you do support this concept. Number two, I would like to move forward with all the things that require, that kind of backing, to know that it's there before I ask for it. I would like to, gather the people at the community college, which I'm doing right now, and to put together something there that would combine with this as another part to the program. And thirdly, we're talking with Nick here to develop a VA clinic here in Tillamook County. And none of this is going to happen overnight.
Thank you, Doctor. I appreciate your frankness. I do. Thank you.
And I happen to know, and so do you, that the whole area of government processing is difficult. So, we gotta go through it.
Thank you.
Well, Dr. Olson, first I appreciate your service, and I appreciate your vision in this case. As the previous executive director of CARE, I had a lot of opportunity to have interaction with the very people that you were talking about serving. And we worked very hard with placement in various crisis centers and response that we didn't have locally. So for me, the idea of having something here in Tillamook County would be phenomenal. And I have no doubt that it would serve a really critical population, both of those who are here in Tillamook and others in surrounding communities that are doing the same thing to try to find placement when someone is in crisis. So you've keyed on a much needed service. I think that the transcranial magnetic stimulation piece sounds very interesting. There are definitely challenges that cannot be treated with medication successfully, and that definitely put people in more difficult situations, as you've described. I've seen that personally as well, and just feel like if there is another way, that would be fabulous. So I really appreciate what you're working on. Just to clarify a little bit for me, who would operate this? Is this Virtue at the Point? Is it sort of an expansion of theirs down to Tillamook, or are you talking about creating a whole new sort of organization in Tillamook? Help me with that a little bit.
Pretty much the latter. And I currently have a machine, if you want to see it, over at 2nd Street.
Okay.
We our intent is to initially do most of this up at Virtue in Astoria, at least the next 30 days, and then to bring it down and obviously to get a second machine, and these are expensive, and I know that because I paid for it, and so far we have no public funding, no nothing from anybody but me, and so as to putting this into Adventist, Eric has indicated that he would support this, but there's no place for it at Adventist Hospital.
Mm-hmm.
And Adventist Hospital does not have a Tri-West contract. They have no contract to take care of veterans. And it's somewhat complicated. Neither does the Coast Guard. There's no contract to take care of the Coast Guard. Somebody should. And right now, it's a hodgepodge.
Sure.
And because I'm a veteran, I have to know that I have to go up to Warrington to take care of my PERS and my other things that I have to take care of for me personally. So that's how I got to know these people. So,
So to clarify, you're starting a new organization of which you
Yes.
would be the
Yes.
founder, so to speak, and that ultimately, it sounds like if you go forward in the way you'd like, you could bill Medicare, you could bill Medicaid, you could bill potentially private insurance. So it's really looking at adding to the spectrum of medical providers in our community. Is that what I'm understanding?
yeah, that's it. And the initial treatments on each patient would be done by me and then carried out by a technician. Eventually, we'd like to form a 501(c)(3),
Okay,
but as you know, those can take time.
I do.
And so you can't start a 501(c) unless you start on the ground floor first. So,
Gotcha.
yes, we're gonna try and make enough to cover the cost of the equipment and things. And I have had a verbal pledge from someone in the community that has a foundation of $350,000. But he can't do it now, said he can do it in December. So,
Gotcha.
and that might work.
Gotcha. Okay, you know, I think for me, again, I love the vision, I love the concept, I love the idea of tying in the jobs, because again, I know that also to be true, that this is very difficult to transition to make, and to have that employment tied into it with an employer that is understanding where you're coming from and where you seek to go is all super powerful. I think just from my perspective, I would love to hear actually from Frank and Eric and the people that you've spoken to, just sort of it as to how they see it fitting into our current sort of medical provision system, you know, to understand we are a small community. How does that all fit together? So I would love to be, I don't know if a workshop or if it's just for me and you and those folks to visit, just to understand how that all comes together. Would be helpful for me. But I think it sounds like a great idea, and I look forward to seeing more details come out as it works toward coming to fruition. I can definitely verify and jump on board with there's an absolute need, and I love the vision.
Well, as you just like everybody, the lady that spoke prior, you can't do this in one visit. So
Nope.
this is just the first visit, and
Yeah,
there'll be regular follow-ups.
excellent, thank you. Well, I think this is fascinating. I'd like to hear a little more about transcranial magnetic stimulation. What is it and how does it work?
Okay. It's actually a variant of a couple of devices. One is deep brain stimulation that we do in neurosurgery, and the other part, it has to do with what we call motor evoked responses. And there is something called, for example, if you stimulate your toe with electric shock, a pulse goes up the nerves and goes up to finally reaching the spinal cord and up into the brain, and you see a little electrical activity there. And when you take that electrical activity and take 1,000 of them and have the computer measure those and average those, it's called a somatosensory evoked response. And because of that, it gets complicated because it's a long word, and so most people say that's a nerve conduction study. And so people have been getting nerve conduction studies for years. And it's what we do in neurosurgery. You say, you've got a numb spot here, well, let's figure out what it's from, and we get a somatosensory evoked response. Well, from the other side, if you stimulate the motor area in the brain, it also goes down to the area that supplies, and we call that the motor threshold. So when we do this type of therapy, we neurosurgically would measure the speed, and get 1,000 of those again, measure them, and measure the motor evoked response. That's a standard treatment that we do in neurosurgery when we're worried about a nerve loss or a brain or a disc loss, is pinching a nerve in the neck and things like that. So when we perform this study, the first part that we do, the part that I have to do before the technician can take over, is called a motor threshold. And so we stimulate with special coils, and what is different about the brainwaves deep is it has two different kinds of coils, different than all the other manufacturers. They have the figure of 8 coil and the H1 coil, and these coils penetrate significantly deeper. And it's the reason why this machine is approved not only for PTSD, it's approved for major depression, it's approved for obsessive compulsive disorder, and it's just got approved for addiction. And the first addiction that they approved is smoking addiction. And of course, all addiction is the same neurophysiologically. And it's a word called, well, you've all heard the word mindfulness. And mindfulness means something when, for example, an alcoholic finally, after years, reaches a point where they come to a position where those changes in their brain occur, and they are still classified as an alcoholic, but they no longer have that craving, and they've changed the brain chemistry. Our brains, the prefrontal gyrus, which is the area that we talk about when we're talking about TMS, has a nucleus called the nucleus accumbens, and I hate to use all this stuff, but you asked for it. The nucleus accumbens we target, and that is where drugs that we talk about for depression are affected. That's called serotonin is produced there. If you don't have enough serotonin, clinically you're depressed. If you have too much, clinically you're crazy. And to put it in another way, we try to raise those levels to a normal functional level at the nucleus accumbens, and when that changes, the proteins in the brain change, and something called nucleogenesis, or new brain cells form, and it actually changes function. And this machine is also being used in Europe for stroke rehab, for growing new brain cells, for post-concussion syndrome, for the football players, and it's a really big deal. I got, as I said, onto this through neurosurgery, but I was at a meeting in Scotland a couple of years back, and there the head of NIH stood up and spoke and said, "This is the newest thing we got, and you got to pay attention, and because this is going to change what we do." And so here we are, and I'm trying to do it.
Well, I think it's very exciting. Thank you for coming in and making this presentation to us, and thanks, Nick. I will be interested in next steps. It seems like,
It's about 70% effective,
okay,
proven already.
okay,
The success factor comes in about 2 weeks after you start treatment. Treatment consists of 30 treatments, average. It's not perfect. As I said, it'll 70% is enough to get you so you don't kill yourself. But you might have to have a pickup down the road next year, the year after, whatever. It's not uncommon, and I can guarantee you that machines will get better and will get smarter. But right now, it can save lives.
well, I think this is very exciting and very interesting. And like Commissioner Scar, I'll be interested in seeing the next steps moving forward. I would assume that as a board-certified physician in Oregon, you can start a private practice and
Yes.
start delivering this service. And you said that you can charge Medicaid and Medicare for veterans. So I would think that you don't need our blessing to move forward. But if we're talking about a behavioral health care clinic, where then I think there are the team of behavioral health care providers in the county. We would want to get together with that team and see how, as Commissioner Scar was suggesting, see how it all is interconnected. And I know funding is part of that, and the ability to bill for behavioral health care services is part of that. And so I think this is I hear you saying you invested in the machine, and you've gotten started in Astoria, which is really exciting, and so that it feels like we're in the initial stages, and speaking for myself, I'm certainly interested in seeing it move forward and what the possibilities are.
We were doing exactly the format that you described, and so, yes, I can start a private practice, but there's only one of them. And-
Right.
And I'm old, I don't wanna stay up all night, and, but we will and are moving exactly in those directions.
Terrific. Well, please keep us informed and invite us
Yes.
to your meetings, and we'll be excited to hear more.
Because nothing can occur if we develop a right crisis center unless it comes through the guts.
All right, thank you so much.
Well, thank you, very exciting.
Thank you.
Thanks, Nick. Item 7 on our agenda is the consent calendar, which is a liquor license modification applications for off-premises sale, change of ownership for Pacific City Shell, Beaver Shell, and Bayside Gardens Shell. So I think we can move to approve the consent calendar.
Okay, I move to approve the consent calendar.
And I would second.
We have a motion and a second. Any further discussion? Hearing none, I'll call for the vote. Those in favor signify by saying aye.
Aye.
Motion passes. Item 8 is, under Sheriff Matt Kelly, consideration of an intergovernmental agreement with the City of Rockaway Beach and Tillamook County Sheriff's Office for law enforcement services. Good morning, Under Sheriff Kelly.
Morning all.
Good morning again.
This agreement has, City of Rockaway had approached us a couple months ago, due to personnel issues and they approached us about contracting for law enforcement services for the City of Rockaway. Myself and the city manager spent a lot of time going over this, and we've entered into this, or asking to enter into this agreement to provide deputies and provide law enforcement services for the city. It'll be difficult, but it'll be worth it in the long run, and in the best interest of the county, and I believe that, and when we get through it, it'll be the best interest for Rockaway Beach too.
I appreciate all the work that's gone into this. These are not easy agreements to come up with. I absolutely understand, especially when you're shorthanded as it is already at the sheriff's office. But I see what you see. Looking down the road, this is going to be best for all parties, I think. So I'm in full support of this.
Yeah, I am in support as well. We had a good conversation at 8:30, and I think for the folks in the community to recognize that the City of Rockaway Beach was struggling, has dissolved their police department, and that the county would be responding to that in dire situations anyway without this contract, but having this contract just allows us to be very intentional and very forward-thinking about providing public safety across the county, and having Rockaway Beach have some dedicated officers will really help that. It is a key area where we draw a lot of tourists and a lot of activity. So I think it is, as Commissioner Yamamoto said, looking down the long haul, it's a good choice. And yes, it will take some intensive hiring. So I'm happy to hear that you'll have 2 officers, ready to go for that community to get it started, and that the hiring continues. So thank you for that.
And I was glad to hear that we'll be able to hire 2 of the officers from Rockaway Beach are moving to the sheriff's office. Is that correct?
That's correct. They're both in background process. One has been given a final offer, and the other, any day, they'll be given I suspect they'll be having the sheriff's interview, and hopefully by this week. It's just the way the state requirements for hiring law enforcement is very challenging, which is, to back up a little bit, it's going to be difficult for a small town to have a small department. Within the next 10 years, I think it will be very rare that a department under 10 man will exist in the state of Oregon. The requirements for hiring and training and stuff get more and more difficult every session. So that's put hurdles, but I think we'll have those 2 on shortly. Yes.
That's great.
One other issue that I just thought of, and Bill, I know you looked at this, but so if we approve this today, right now, this takes effect tomorrow, is that correct?
Correct.
And you're prepared for that?
I'm prepared. I know what I'm getting into. Like I said today, it's a good thing. It doesn't mean it's an easy thing. But I know what I'm in for, and we'll make it work because I can see the reward coming out the other side. And
Absolutely.
I plan on covering a couple shifts in Rockaway. The sheriff will be covering a couple shifts in Rockaway. We will make it work. That's the easy part. It's just, it's gonna be difficult, but we'll make it work.
Hey, Commissioner, Bell, this morning, David mentioned that, you know, the process of people making edits, and I came along at the 11th hour, but one of the areas that I saw had been under discussion was indeed the starting date, and, you know, again, looking in towards the tail end, it appeared that it was moved up till tomorrow, just because primarily, I think, and of course, I'm sure, correct me, you know, the city wanted to get some presence there as soon as they could, so, you know, that's, yeah, it's a pretty quick start date in terms of when you're seeing it, but, you know, that all went into the conversation before it came onto your desk today.
Well, I am certainly in support of this. Okay. So I think we're ready for a motion.
Consideration of an intergovernmental agreement with the City of Rockaway Beach and Tillamook County Sheriff's Office for law enforcement services. I move approval.
And I would second.
A motion and a second. Any further discussion? Hearing none, I'll call for the vote. Those in favor signify by saying aye.
Aye.
Motion passes. Thank you, Under Sheriff. You have the next item also, the consideration of an intergovernmental agreement with the City of Rockaway Beach for court services.
It's just an add-on to the agreement providing law enforcement services. It's not, if you have a small town police department, you usually have a small municipal court to go along with that to handle fines that occur within your city limits. Since they won't have a police department, it's in their interest to contract or essentially enter into agreement with the county to handle all citations through our justice court, and it alleviates some stress and some personnel issues and some funding issues that way. And then in our eyes, it makes it easier for us. We're not having to cite into multiple courts and check the wrong box and you have to reissue citations. So, and it's the best interest of the county and then Rockaway Beach City also.
Perfect.
In agreement, we heard from Judge Cano this morning that he was expecting this and that it was not a undue hardship or burden for him, so that it just makes sense, as you've said, to keep the two together. So.
All right. I think we're ready for a motion.
In consideration of an intergovernmental agreement with the City of Rockaway Beach for court services, I move approval.
And I would second.
We have a motion and a second. Any further discussion? Hearing none, I'll call for the vote. Those in favor signify by saying aye.
Aye.
Motion passes. Thank you.
Thank you, Madam Sheriff, and good luck.
I don't need luck, we'll get her done.
There you go, I like that.
Item 10 is consideration of a professional services agreement with Roger Cook, PhD, LPC for sex offender assessment and counseling services. We have Lieutenant Bonnie Seaholm from the Sheriff's Office.
Good morning again, Commissioners.
Good
Good morning.
So in consideration, it's a professional services agreement with Tillamook County Community Corrections and Dr. Roger Cook. He currently provides our sex offender assessments and treatment groups to individuals that we supervise at Community Corrections. Anybody who's been convicted and has conditions surrounding sex offender treatment from either the parole board, the court, or through general conditions would need to have a way to participate in group and assessments, and there's a cost to it. Insurance doesn't cover it, and so this would take off the financial burden to the offender at first. We would then bill them back, so they are still held accountable for what they need to comply with and participate in. And so this contract would just button it up so that way we can ensure that the people that need to be in these programs are able to get into those programs without having the financial burden, and also held accountable.
I think that's terrific. It's a good model because you wouldn't want money to prevent somebody from getting the treatment they need.
I appreciate all your work on this. All of a sudden, I'm thinking about the presentations from Dr. Olson. Transcranial magnetic stimulation. He did not mention anything about this having an effect on sex offender treatment, but that's something that we need to look into further too. So I think that's great.
Yep, I think it is a good model. We definitely want people to have the treatment they need. Our goal is to have people not reoffend, and the best way to do that is to make sure they have the treatment they need. Ani, you and your staff have such a huge social work component to what you do, and it's fabulous that you have this contract to support that, so that you're really supporting people who are coming out in not reoffending. So we don't want money to be a reason that they can't get the services they need, therefore complicating what you are working to do and the safety of our communities. All right, so, okay, in consideration of a professional services agreement with Roger Cook, PhD, LPC, for sex offender assessment and counseling services, I move approval.
And I would second.
We have a motion and a second. Any further discussion? Hearing none, I'll call for the vote. Those in favor signify by saying aye.
Aye.
Motion passes. Thank you, Commissioner.
Thanks, Ellen.
Item 11 has been postponed, so moving on to item 12, consideration of an Oregon Office of Emergency Management fiscal year 2021-2022 emergency management performance grant application. We have Gordon McLeod, Director of Emergency Management.
Good morning again. So again, this is the Emergency Management Performance Grant that's effective from July the 1st of this year until June 30th of next year. It's an annual grant that we've been receiving ever since I've been here. The amount that we get is based, of course, on what the state gets from the feds, and then they divide it up flat amount per county, and then they build in a extra amount based on your population. So this year it's a couple $1,000s more than we got last year. It pays strictly salary, so it's a 50-50 grant. It pays half of my salary, and just to eat up the rest of the amount, we added 0.25 FTE, which is currently the undersheriff. And the reality is, when the grant finally gets approved, the 0.25 will get reduced to equal the total amount of the grant. And again, it's an annual thing, and it's a good thing. The only other thing that we'll add to it is down the road, a work plan comes out, and the work plan defines what training, exercises, and plan review is required as part of the grant agreement by the emergency manager.
Thank you. I agree. It's a very good thing to get half of the position paid for. So I'm in full support of that.
Agreed.
We're good.
Okay. Then in consideration of an Oregon Office of Emergency Management fiscal year 2021-2022 emergency management performance grant application, I move approval.
And I would second.
We have a motion and a second. Any further discussion? Hearing none, I'll call for the vote. Those in favor signify by saying aye.
Aye.
Motion passes. Thank you, Gordon.
Thank you.
Item 13, I will carry. It's consideration of an order in the matter of the appointment of a member to the Tillamook County Fair Board. We are looking to appoint Sarah Christensen to the Fair Board. Sarah Christensen has been a fair volunteer. She is a local person. She's well-versed in ag and animal husbandry, and she can drive power equipment.
So can I.
She has visited the Fair Board meetings. The Fair Board is in unanimous approval of her application, as am I, as the liaison, and so we would like to appoint her to the Fair Board today.
This is a perfect thing. I mean, the Tillamook County Fair is renowned throughout the state and much of the United States as being one of the best small fairs around. And it truly is. And one of the things that really makes this happen is the Fair Board. They go above and beyond. It's taken on a life of its own, but something else that the Fair Board does that most other Fair Boards don't do. Most other Fair Boards are pretty much management. This is much more of a hands-on Fair Board. They do so much work out at the Tillamook County Fairgrounds. And just so everyone knows, again, this summer looks like we're approaching what should be a much more normal fair, a real fair. And I think that is terrific, and I'm sure everyone is looking forward to that. I know I am. So, I think this is great. She has been to a Fair Board meeting or two on her own, so absolutely the interest is there. And she can drive power equipment, that's just terrific.
Goes back to what the Fair Board really has to do to
Yes.
make this fair happen, right?
Absolutely.
You've got to be able to participate and contribute in all kinds of ways. So we appreciate Sarah's interest, and I certainly am in support.
All right, I think we're ready for a motion.
In consideration of an order in the matter of appointment of a member to the Tillamook County Fair Board, I move approval.
And I would second.
A motion and a second. Any further discussion? Hearing none, I'll call for the vote. Those in favor signify by saying aye.
Aye.
Aye. Motion passes. Well, welcome Sarah Christensen to the Tillamook County Fair. All right, moving on to board concerns.
Good.
All right, I'd like to just reiterate what Commissioner Yamamoto said. We are indeed planning a fair this year. The assumption is that all of the COVID guidelines and considerations will have to be dropped by August, and we can plan a complete fair. And so I think that most of the elements that we associate with the fair will be present. We're including the carnival. There was question for a while about whether we'll have a carnival.
Wow.
We'll have a carnival, we'll have horse racing, pig and fords, of course, all the 4-H and land products and the junior livestock auction, and so it'll be a real Tillamook County Fair. It takes an entire year to plan a fair, and so, we've been working on it, but we couldn't fully plan it not knowing what was happening with COVID. So there may be some minor changes, but I don't think that it'll be anything that people really notice or miss. I think by the time August gets here, it'll be a full fair, and we're all just gonna be really, really happy to celebrate our post-COVID season with the real Tillamook County Fair.
That's exciting.
It is exciting.
Super exciting.
Yeah, so
Yes.
people can start, putting together your photos or artwork or quilts, planting things in your garden that you want to exhibit, planning out for your baked goods and flower exhibits, and everybody can put it on their schedule, August 11 to 14 this year. All right, do we have any public comments, Isabel?
You do not.
We have no public comments. In terms of board announcements, we want to announce the cancellation of our board briefing this afternoon. It was scheduled, is now canceled. At 1:30 today, we're not having that, and we're also not having the Friday, June 11th American Rescue Plan Act funding meeting at 8 a.m. Both of those meetings have been canceled for this week. And with that, we are adjourned at 11:05.